A is a collection of infected fluid that hasn't drained away. A. Abscess. B. Dehiscence. C. Fistula. D. Evisceration. Blood stops bleeding during hemostasis. A cut made by a sharp instrument during surgery that gives access to an organ or space in the body. A. Incision. B. Puncture. C. Abrasion. D. Stoma. If a lesion has been in the inflammatory phase of healing for 10 days without progressing and the surrounding skin has remained erythematous and edematous, which of the following should the healthcare provider initially suspect? A. Secondary trauma. B. Immunosuppression. C. Infection. D. Inadequate protein intake. A nutritional assessment should be performed within of admission, as recommended by the Joint Commission. A. Superficial partial thickness. B. Predicting pressure ulcer development and determining risk level. C. 24 hours. D. 24 to 48 hours. Which of the following is the appropriate intervention when a wound has a damaged matrix and cell debris that prevents healing? A. Antimicrobials. B. Negative pressure wound therapy. C. Debridement. D. Moisture balancing dressings. When it is appropriate for the resident's condition and consistent with the resident's goals, the removal of devitalized tissue in pressure ulcers is A. Sterile technique. B. Irrigation. C. Exudates. D. Debridement. When it comes to bandages and binders, a straight binder is utilized for A. Wrist, fingers, and trunk. B. Joints, such as the knee, elbow, ankle, and wrist. C. Chest and abdomen. D. Head, fingers, and stump of an amputated limb. From day 3 or 4 to day 21, when the injury happens, this phase of healing gets longer. The area has more collagen. Capillaries run across the wound. A. Proliferative phase. B. Maturation phase. C. Inflammatory phase. D. None of these. Which diagnostic test is best recommended for a patient who follows a strict vegan diet and doesn't eat any foods containing gluten or legumes? A. Bun. B. Vitamin D level. C. Prealbumin. D. Zinc level. Red blood cells are made of a protein that gives them their red color and their capacity to carry oxygen. What is the name of this protein? A. B12 injection. B. Primary. C. Hemoglobin. D. Iron deficiency. An illustration of a wound that most likely may see secondary healing is A. An infected wound. B. A clean laceration. C. A split-thickness graft. D. An extensive contaminated dog bite wound. Which product offers the best and longest skin protection against incontinence? A. Moisturizers. B. Powders. C. Lotions. D. Moisture barriers. Which phase constricts blood vessels to allow blood clotting and dilates to promote capillary permeability, allowing plasma and blood components to leak into the damaged area? A. Inflammatory phase. B. Hemostasis. C. A and B. D. Proliferation phase. What is the main function of wet-to-dry dressings? A. To perform aseptic cleansing. B. To mechanically debride a wound. C. To provide an aesthetic appearance to wound dressing. D. To protect the wound from further injury. The kind of wound most likely to contract at the slowest rate is A. Circular. B. Rectangular. C. Square. D. Linear. Creating new blood vessels is formally called A. Biogenesis. B. Angina. C. Coagulation. D. Angiogenesis. What should be considered when assessing a patient's nutritional status is the typical daily caloric requirement for effective wound healing. A. 1,500 to 3,500 calories day. B. 2,000 to 3,000 calories day. C. 1,000 to 1,400 calories day. D. 3,000 to 4,000 calories day. What nutrient repairs the body from damage, produces new tissue, and supports many critical body functions? A. Carbohydrate. B. Protein. C. Sugar. D. Fat. Transcyte is prescribed to treat A. Arterial ulcers. B. Surgical wounds. C. Burns. D. Venous ulcers. What do you call a strip or roll of cloth or other material that can be wrapped around a body part in different ways for different purposes? A. Bandage. B. Scarf. C. Bandana. D. Gauze. On wounds, silver nitrate chemical cauterization is used to A. Control bleeding. B. Decrease exudate. C. Debride ulcer. D. Treat hypergranulation. What happens in the first phase of wound healing? A. Hemostasis. B. Inflammation. C. Angiogenesis. D. Granulation tissue formation. Which of the following therapies is recommended as a first line of treatment for weepy, red, itchy atopic dermatitis? A. Hypoallergenic creams. B. Topical antihistamine. C. Topical antibiotic. D. Wet aluminum acetate compresses. Pressure ulcers can be caused by dehydration and malnutrition. A. False. B. True. The best course of action for a patient who is nearing his death and has begun to form a pressure area on the sacral area but who groans loudly and resists the nurse assistant's attempts to turn him is to A. Transfer the patient to a bed with an alternating pressure mattress. B. Turn the patient frequently to prevent further skin deterioration. C. Allow the patient to lie undisturbed as much as possible. What is used to make the skin tacky and secure a steri-strip? A. Iodine. B. Vaseline. C. Cold cream. D. Tincture of benzoin. When taking steps to avoid friction that could lead to a pressure ulcer, which of the following should be avoided? A. Skin sealants. B. Talcum powder. C. Alcohol-based skin barrier. D. Cornstarch. A synonym for coagulation is A. Clotting. B. Scar. C. Remodeling. D. Inflammation. The skin layer that lies between the stratum corneum and the stratum granulosum is known as the. It is made up of translucent cells that are exclusively found on the soles of the feet and the palms of the hands. A. Stratum corneum. B. Dermis. C. Stratum lucidum. D. Stratum bile. Wounds need to be cleaned the first time and every time the bandage is changed. A. False. B. True. Pressure ulcer is synonymous with which of the following? A. Bedsore. B. Decubitus ulcer. C. None of the above. D. All of the above. A bandage consisting with big pieces of material to fit a specific body part, typically made of elastic, cotton, muslin, or flannel. A. Gauze. B. Tie. C. Bandana. D. Binder. How would a wound that initially healed as expected but then showed signs of plateauing and stayed unaltered for the second and third weeks be classified? A. Recalcitrant wound. B. Stunned wound. C. Acute wound. D. Chronic wound. If you've lost of your weight in the last 3 months, that means your nutrition has gone down a lot. A. 10%. B. Medical battery. C. Calciphylaxis. D. Patient abandonment. What is the shortest amount of time that an EMLA cream should be applied before initiating a dressing change in order to relieve pain? A. 10 minutes. B. 15 minutes. C. 35 minutes. D. 60 minutes. The most important rule to follow when deciding when to change a pressure ulcer's dressing is: A. Keep the ulcer tissue moist and the surrounding intact skin dry. B. Keep the ulcer tissue dry and the surrounding intact skin moist. C. Keep the ulcer tissue and surrounding intact skin dry. D. Keep the ulcer tissue and surrounding intact skin moist. The main goal of using an UNA boot while ambulating is to: A. Apply continuous static compression to the lower leg. B. Apply continuous dynamic support to the lower leg. C. Apply dynamic support to the calf muscle pump. D. Provide static support to the calf muscle pump. What is a keloid? A. This is another phase of wound healing. B. A painful disease involving tissue damage. C. Overgrowth of a collagenous scar tissue at the site of the wound. D. Same as an eschar only with a lighter color. What is the separation of one or more layers of a wound caused by too much pressure on a wound that hasn't healed? Muscles are usually intact in this state. A. Evisceration. B. Dehiscence. C. A and B. D. Fistula. Collagen and elastin are the proteins that compose the dermis. Both of these proteins are in charge of: A. Giving skin tensile strength and providing the skin with elastic recall. B. Secondary. C. Decompensated CHF, peripheral arterial disease, ABI. D. Bacteria. What happens to the skin as it ages? A. Becomes thinner and drier. B. Does not change. C. Becomes thicker and drier. D. None of the above. This wound usually heals between days to weeks. Infection is reduced by well-approximated wound edges. A. Acute wound. B. Abrasion wound. C. Unintentional wound. D. Chronic wound. After surgery or injury, what is a collection of extravasated blood stuck in tissues or organs? A. Evisceration. B. Cellulitis. C. Hematoma. D. Extravasation. During what part of the healing process does the body's general response show up most? A. Inflammatory phase. B. Hemostasis. C. Maturation phase. D. Proliferation phase. A patient's coccyx has developed a pressure ulcer, Based on what you know about wound closure methods, how do you think this wound will heal? A. Irregular wound margins, heavy exudate, hemosiderin staining, medial lower leg, ruddy granular. B. Activation and aggregation. C. Secondary intention. D. Category 1A. Do pressure ulcers typically develop over bony prominences and are caused by persistent pressure that damages the underlying tissue? A. False. B. True. What is the best dressing to use when a deep ulcerated area has a lot of exudate and the drainage is caused by tumor necrosis? A. Alginate. B. Foam. C. Gauze. D. Charcoal dressing.